Hello, this is Jane Coombs of Working Well Solutions, and today I've been asked to talk about home visits in occupational health. And what this means is when your employee's off sick and you ask occupational health to go along to visit. And it's quite a controversial area, so well worth the time in thinking about the benefits of home visits in occupational health. So, why do a home visit? After all, the people are at work, and if they're off sick, they're off sick. But it may be that you need to have some more information about their sickness, their illness, and they may be unable to leave home, they may be unable to talk to you on the telephone. They may have a terminal or serious illness, and you want to provide some other support in terms of physiotherapy, or perhaps you're going to access their ill health retirement. It's important when you think about doing a home visit that there is no other suitable arrangement, because it is really quite an intrusion into a person's life, and there also is a degree of risk for the person making the visit. So for that reason, home visits are generally done with another person. When considering the benefit of a home visit, you may want to think about the time that it takes. Generally, people stay in the house about an hour. You have to think about travel expenses and the time taken to travel. If you work for a national company, then often you may have to travel quite a long distance and back again. Think about insurance as well, whether the occupational health person and the HR or manager is insured if it's their own car to do company business, especially if you're taking equipment with you. You must of course do a risk assessment for the visitors and make sure that they're not going to come to any harm. And then the confidentiality. Obviously, if you're in somebody's home and you're with a manager or a HR, then there's going to be limits to what you can talk about. So it may be that you need to consider that, and perhaps what I've done in some cases is to ask if I can have sort of 10 minutes on my own with the person, and we just go through some questions that I believe would be better asked in a confidential atmosphere. The other thing you got to think about is the level of practitioner that you're going to be sending out. Obviously, if it's newly qualified or needs a full examination, then maybe an occupational health physician would be better. And the more experienced occupational health practitioners generally tend to fare best in this type of home visit situation. The procedure also should consider the lone working risks in the home, and that can cover anything from dogs biting your leg, somebody not being in, parking, carrying equipment, fragrances, flowers. Some people are allergic to some flowers. All of these things have got to be taken into account in the lone working procedure, and also procedures for when people leave the house and have got home as well, making sure that they're safe. So once you've decided that you are going to go ahead with the home visit, then that needs to be arranged with the employee. And I have to say, I've never had anyone turn down a home visit from the employee side. And obviously a consent to visit the house, because again, you have no right to be there. And you arrange the time that you're going to be there, the place, and who's coming, because it would be quite an anxious time for the person, and whether their manager's coming or human resources with the occupational health person. Of course, you've done the risk assessment, but you must make sure that that's relevant, especially with parking and carrying equipment, as I said before, but the health and safety of the visitor. And in some cases, for psychiatric issues, you can have violence and aggression in the home from either the employee themselves or from relatives who may be there. And then emergency arrangements. What do they do if this happens? Do they need special training? Who do they call? What's their route of exit? So emergency arrangements are quite important as well. If there is a danger of being violence, then I would suggest that the visit wouldn't go ahead anyway. During the visit itself, so you've arranged to go along to the house, the person knows who's coming, why you're coming there, and the occupational health is there for the medical matters. They're not there to introduce the session or take control of the interview. It's there specifically for medical matters. So the lead should be taken by HR or the manager who's there with you. I've already said that confidentiality may be difficult, and it really does become difficult if there's only one room in the house, or there's other people there, or there are some issues between the manager and HR, or examinations may be awkward due to the height of the bed or the chairs or clutter around. Remember too that the employee can ask you to leave at any time, and don't be dismayed if that happens. Before you go, after you've had your discussion, they've answered your questions, now would be the time to discuss getting the consent for a GP or specialist report, especially if you're looking for a prognosis when they're going to come back to work. You leave, you write up the report and send a copy to the employee. You also would arrange for the next visit if that was needed, and feedback. Now this is the important part. If you are doing a lot of home visits, it's important to reflect on the success of it. But the first thing is the cost. And the cost is not just about money, it's about time, it's about resources. How much did the home visit cost? The time you travel and see someone for an hour and then you travel back, the risk assessment, all of these things, they all add up. Did you get what you wanted from the employee? And do you think the employee got what they wanted as well? Did the employee cooperate with the process? Or were you there under sufferance? Did they enjoy it? Did you enjoy it? And were there any negative outcomes? I believe it should be done rarely and in extreme health circumstances with very clearly defined objectives. So, thank you very much for watching this. This is Jane Coombs of Working Well Solutions. I hope you've enjoyed it. If you have any questions, please go to my website at www.workingwellsolutions.com or email me on jane.coombs@workingwellsolutions.com.